twists, leg kicks, arm circles, side lunges. Again, you know like what's sore and stiff on your body. Like for myself, I gotta work my knee and my ankle a little bit before I play, shoulders as well. The dynamic warm-up is really good at three things. Improving your mobility, at least acutely, before you play. Priming your nervous system, right? You just sat in your car for 20 minutes. You're not really moving around much. Priming your nervous system is going to help you swing harder, more comfortably. And then increasing your heart rate, again, the actual warm-up part of it, okay? So strength training. Who answered strength training? Was it Josh about the best way to reduce injury risk? It's strength training. So it's not plyometrics, it's not stretching, it's not cardio. It's really strength training and then volume control. Combine those two things. And the strength program doesn't need to be complicated at all. A few days a week, right? Recommended 2 to 3 days a week, 30 to 45 minutes. And if you're focusing on bigger movements, the workouts don't have to be super long and complicated. Paragon, you guys use a lot of, really great movements. Squats, deadlifts, pressing, and rowing is really the bread and butter of most programs. You can do dumbbell, cable, barbell, kettlebell. Again, those are different flavors of the same movements, but it's pick a few, one day a week, pick a few, other day a week, progressively overload that over a few months, and you will get stronger, and you will build muscle. Now, I simplified that. There's a lot to it. Strength coaches and PTs can help with that. But again, it doesn't have to be overly complicated. So when I say build your gas tank, what do you guys think? What does that mean? I've talked about a lot of overuse injuries, right? Too much volume. So what is building the gas tank mean? I'm not answering this.
So when you get tired, you're not, I'll say, keeping your form at the beginning of the round when you were strong. You're tired now, so you have a different posture, you have a different thought process, and that's what eventually causes injury.
Yeah, so when we talk about those overuse injuries, again, it's getting to the point where your body starts breaking down, whether that's technique, whether that's the actual muscle tendon, nervous system fatigue. You get to a point where something is breaking down, causing inflammation, causing pain, right? When we're building your gas tank, that's all of this preaching I'm doing about the exercising, improving mobility, improving strength, plyometric power and endurance, is you're going to bring your floor up, right? That's also going to raise your ceiling up for your gas tank during the round. A lot of injuries happen later on in a range session or later on in a round where maybe you're on hole 16, 17, you swing, maybe you chunk it a little bit, it's something that normally wouldn't hurt your low back. Now you pop something, you strain something because you take a little chunk or you hit a root. Maybe on hole 1 or 2, wouldn't have been a huge deal. But you're 16 holes in, maybe a beer or 2 in, and you're just feeling a little fatigued and a little dehydrated, and there it goes. So again, the capacity movement throughout the round goes down. What you can do to increase your gas tank throughout the round is all the stuff you do before, right? Months before is the training, the strength training, the mobility work as well. And that's the mobility your volume in practice. Okay? Does that make sense? So this is the recommended exercise per week. How many of you guys think you're hitting that? I'm not. But that's the recommendation as far as cardio and strength training. The cardio especially, I don't know if you guys walk or mostly ride in the car. If you're a big walker on the course, getting that extra cardio a week. Walking on the course would count is this zone. It wouldn't be vigorous, but that certainly counts toward your input per week there. And then again, strength training could be just a few days a week. Use the full body, whether it's free weights or machines. Again, it doesn't have to be perfect. I think imperfect exercise is better than none. I'm sure Luke could attest. A couple of days between, and again, you just progressive overload over a few months, and you will get stronger.
Do those recommendations change with age?
What's that?
Do those recommendations change with age?
These recommendations? Yeah. No. Nope. Nope. This is for everyone. If you're breathing, this is a recommendation. obviously there's natural aging, right? I like the quote that, I'm gonna screw this up, but it's, we don't get stiff because we age because we don't work on mobility. So, it's years of not working on some of these things, and again, there's some age-related change in the spine and in the joints, I'm not discrediting that, there is. But you can certainly slow that process down. Again, what research shows, even if you are a repetitive athlete in a repetitive sport that has a lot of wear and tear, that is better for your joint health than doing absolutely nothing, right? The person that's doing nothing will likely have earlier onset arthritis, along with other healthcare issues as well, versus those that are maybe a single sport, doing the same thing over and over again with that wear and tear, gonna be better off than being a couch potato. Okay, who wants to swing faster? We all do, right? So power and speed are two things that are really sought after in golf, right? We see Bryson swinging out of his shoes, really fun to see those long distances. And what it really does is, there's four ideas. First, you need to have the muscle and the strength, right? That's number one. If you don't have any muscle, no strength, you're not gonna be able to swing hard, even with really good technique. And then the power turns your strength into speed. So it's one, do you have the strength, and then can you use it, right? How well and efficiently can you use it is when a swing coach comes in. So you build a muscle, you start building a little plyometric power speed. Okay, that's great. And how well can you use it with your technique, right? And that combines everything there, along with mobility. So larger ranges of motion in the swing, gonna help you with better swing, more rotation. And that combines with the strength and the power. And then again, it comes down to technique as well. Okay? So a few things to think about for power. It's lower body force production. If we break that down into an exercise, squats and deadlifts, if we're not even talking about golf, squats, deadlifts, and lunges, pretty simple. Rotational power, there's different machines that can work on that. There's also cables and free weights as well. Good sequencing with the swing coach, and control and balance. If you have baseline pretty poor balance, the sequencing and swing technique likely will falter as well at some point. You gotta train fast to get fast. I think Shambo might say that, but
Yeah, he's a good example. I mean, he used to hit, he wasn't a long hitter for like 5 or 6 years on tour.
Yeah.
And put on 40 pounds, 50
Yeah.
pounds of weight. Shed some of that since,
Yeah.
but he started putting on muscle
Yeah.
and weight, started swinging faster and faster in his training
yeah,
sessions.
so he bulked up, he put on the muscle, right? Then he learned how to use that muscle. He did trim down,
Yeah, he's
worked on his mobility.
He still got that speed, even though he's.
But he maintained that speed and power because, I mean, he was like a bodybuilder for a bit there. I mean, he was putting.
I mean, that's what's so fascinating about a lot of golfers though, is, you know, the Colin Morikawa, Justin Thomas, they're 5'11", 6
Yeah.
foot 170, right?
Yeah.
They're thin guys.
Yeah.
Their sequencing so good.
Yeah.
They
Yeah.
use all their body,
Yeah.
use everything in that swing.
Yeah, and those guys don't look like, I know, like.
And they are in the gym every week.
Right, they're in the gym all the time, and they're not putting on muscle, right? Like McIlroy, Rory, he's an example, he's just like a freak athlete.
Yeah.
Shambo, some of the guys too, but they're maintaining their muscle at least and their strength. They're still very strong, and they're working on their mobility and then sequencing the strength, the mobility, and the sequencing all together, right? But it starts with, yeah, they're very strong and very mobile in the gym. Probably every day they're working out, if not 5-6 days a week. They're in the gym with their trainers or with their PTs.
3 or 4 of those days they're doing high intensity fast.
Yeah, and they're working on that speed all the time. You can follow some of these guys on social media, and they post their workouts occasionally, and they're really interesting to watch. Yeah, it's pretty cool. Alright, I'm going to show you just a few lower level examples of some speed exercises. I need my lovely wife to come up and help. So you don't need much. We got a weighted ball, we got a small kettlebell, and we have a TheraBand. So all of these are much lighter than I would, like myself, would use in a gym. I'm just gonna show you just for the example today. So we're gonna go down to, so rotational power we talked about. Med ball tosses are a really good one, either high to low, low to high, or rotational. You can go high to low, you can go straight down to work on that sequencing. You can do the same thing with the band as well. So I'm gonna have to, yeah, I'll just do it this way as a
Put her on the other side.
yeah.
There you go.
There we go. So with the band, you can buy a kit of these online. You can tie it to something sturdy. You can bring the level up and down a little bit, and you can simply work on rotation through, go high to low, low to high, and then you can also start working on more of the speed. So start adding some of the speed with different movements with that. That's a really easy warm-up too, and you can throw that into, that's okay. You can throw that into a workout too. So like in between exercises, you can then get some speed work in, starting slow and then building up the speed with each rep, okay? With the ball, this is just a small ball too. I'm not gonna throw it, but same idea. You can work on different aspects of, you can either throw it or you can hold it. They make the balls that are a bit bigger too, like this. Same idea, building the speed from slow and then just adding a bit more velocity in with the ball. Over speed swing training, just gotta swing fast to get fast with an actual club, right? And then different plyometrics. So one example I like, again, doesn't have to be complicated, is a simple kettlebell swing. This is super light for me, but you can do one hand, you can do two hands. That's really working on that hip extension through core, low back, and hip strength, okay? So just a few ideas there for some speed training. Again, it doesn't have to be like stand on one leg with a band and eyes closed, some of these crazy things you see. Simple, keep it simple, right? Work on speed, the different planes of movement, rotation, and forward and backward. You can also do some jump training as well for plyometrics, always helps. Here's just a quick exercise split for strength training, or really everything here, 2 to 3 days a week. So, maybe work on mobility, maybe it's hips, mid-back for a few minutes. Then you're working on power, some of those examples I just showed, kettlebell swings, rotation power, med ball slams or rotation throws. And then get into the meat and potatoes of the strength training. So maybe that's more of a leg-based day. You're doing some deadlifts, some lunges, a machine here and there would be fine. Maybe some forward. So that's a little recovery, stretching, like we said at the end, foam rolling maybe. So again, that's what, less than an hour or so, and you're hitting everything you need for ball function, right? A few ideas for recovery. Active rest days, so it's not sit on the couch and eat Cheetos, it's go on a walk, or maybe, you have a light chipping and putting session or a light range session. Soft tissue work's always good, either myself, trigger point release, soft tissue work, massage therapy, integrated dry needling, if you've never tried, that is a really nice tool to help boost recovery and reduce soreness, mobility work, and then hydration and diet as well on those recovery days.
Can you talk about the dry needling?
Yes.
What's this? I think I've heard this, but I bet some people haven't. It's like the science behind it is like kind of like creating a little micro fracture type thing in the muscle.
Yeah, who's tried dry needling? Most of you guys? Yeah. Yeah. So it's the science behind it is they're single monofilament needles, sterile, tiny, one time in and out, we throw them out. What you're trying to do, there's two parts of it. Peripherally, we're increasing blood flow to an area to help with the healing, like what you're saying.
Yeah.
Let's say it's a golfer's elbow on the inside here. I could needle along that tendon, not the most comfortable, but you could, I have. And what you're doing is kind of kick-starting this blood flow to the area, which brings in red blood cell, white blood cell, protein, and to help with the healing process. It also can help with acute pain reduction as well. The other part of it, especially with chronic symptoms, you guys have ever had like a very deep massage where you feel a little groggy afterwards? You just kind of feel relaxed in a way, even if they're beating you up a little bit. Same idea as that. There's a nervous system component where it just tunes things down a bit in the brain. So it really has like a two-pronged attack with the needling. And I was trained with the integrative dry needling. It's very neurological based as far as the pattern of how I'm doing what I'm doing with the needles. It's pretty cool. But it's not just see muscle that hurts, poke it, take the needle out. There's a bit more to it if you've had good training to be dry needling certified. But it's nice not only for improving symptoms, but it's also nice for preventative as well. I would say a third of my caseload are people that pop in for, I call them tune-up sessions, and I do a little manual work, review any exercises they need to do. We can needle them, and then they're out. Like they're not injured, they just want to stay on top of things, either as a maintenance tune-up session, I call it, or a maintenance session. Whether they're golfers or runners or weightlifters, they'll pop in. And it's just a nice way to stay in touch, review anything that's needed for those. But yeah, needling's nice. There's a reason why I got certified and paid the bucks to do it. It's a very nice tool. I've never tried it. I think I've needled a few of you here. All right, before we get into the little TPI screen, how are we doing on time? Doing okay. You guys have any questions, specifically anything about low back? I know that's pretty common. Anything with wrists, shoulders, elbows?
From lower back, you're just doing the hip flexibility. I'm still a little struggling. I've had low back pain for 10 years.
So that would be, yeah.
It
So
kind of comes and goes in
Right.
intensity.
yeah, if I did a full eval and we looked at everything, part of the evaluation would be looking at the hip mobility and the thoracic mobility. That'll be a part of it. Not ignoring the low back itself, of course. But with golfing, especially with all that rotation, we're going to look at the rotational joints in very much, very detailed. So what are the rotational joints? Hips and the mid back. The low back doesn't rotate much because the other joints are oriented. Doesn't mean we wouldn't look at the low back and how it's moving, and we would certainly treat what's going on. But we'd also focus on both. I think that gets missed with a lot of physical therapy. There's a lot of bad healthcare in every realm, but we're not just focusing on the area that's in pain, because that's fine. We can certainly do that, but what has led to that? In golf, we know there's not much rotation. We got to focus on other areas as well that would help free up the lumbar spine a bit. Oh yeah, we do a full health screen. Make sure we go through everything needed. Low backs are tricky because most of them are chronic, right? Long lasting. A few needles in your low back, generally, if you've had chronic low back pain, is going to have a minuscule effect on the longevity, right? It's a nice tool to help control symptoms, but it's usually a much deeper dive with the low back, especially if it's very intermittent and chronic. It's no easy answers, but I work with low back probably the most in my patients, getting pretty darn good results. And it's not cookie cutter, like you're saying, it's different with everybody. We're taking past medical history in consideration, of course. All right, let's grab our TPI sheets. Everyone get a little bit of space and grab your wedge. We're going to use that for the test.
People in this simulator.
So the first test, we're going to do the 6 test. So grab a piece of wall. You need a piece of wall. We have some wall there.
Walls, one,
Okay. Have you guys heard of the TPI Titleist Performance Institute. So they have a lot of nice tools. You guys can go online, get some of those. This is a few tests that I thought were the most relevant for today. There's many more tests that they provide here. With a golfer evaluation, we would look at most of the other tests as well, as necessary. So the lat test, everyone get their butt, shoulders, and head up against the wall. So that's the first test. Can you touch all of them on the wall? If you can't, then that's a fail automatically. So you just check off either limited or in pain there. And
Where are your feet gonna be? Are they gonna be on the wall?
feet can be on the wall, yes. Or a couple
That makes
inches,
it hard.
couple inches off the wall maybe, yeah, that'd be fine. Okay, so what we're gonna do with one hand, I want you to see if you can get the thumb up to the wall without any of those body parts coming off the wall, or without your ribs flaring up too much. So I would probably fail this one, and then let's try the other side, we'll compare. So, right, golf is a bilateral sport, both arms are moving. So a bit, yep, so that's tough. Now take your golf club, both hands, and see what we got up overhead. If you have a club, if someone needs a club. You want a club? You good?
Yeah, I can grab it.
So do you feel any differences right to left side? Ribs flaring up a little bit? The lat length is pretty commonly difficult for 90% of the population, I would say. Did anyone feel like really good with that? No, not really, right? Oh, Amanda did. So that one was tough. A lot of modern society has a lot of flexion, computer work, texting. I'm not a posture stickler, but that is one cause potentially of just lat length and just this rounding of the thoracic spine and rib cage. Make sense with that test? Okay. All right, we can put the clubs to the side. Let's start at the top here. So shoulder 90-90, what that one's gonna look like.